Hello, my name is Elena, and today I will be showing you all 5 different ways that we give injections. I have my patient here. Her name is Sally George, and she will be the person that I will be administering these injections on. Alright, so the first injection that we are going to do is called an intradermal injection. So, the first thing that I'm going to do I've got to show you guys. I have my medications by the bedside. This is what we will be using for the needle, for the injection. Alright, so I'm going to access her medical record. And can you verify your name and birthday for me, Miss George? She said her name is Sally George and her birthday is April 1st, 1995. Alright, so by looking at her chart, she is due for a tuberculin purified protein derivative. 0.1 milliliters given intradermally once, and the time to be administered is prior to discharge, which is what we are about to do. Alright. So, what I'm going to do is I'm going to, normally I would have the patient lay their forearm on like a table, but for the purpose of the video, I'm just going to hold it like this while I'm giving the injection. Alright, so when you're inspecting the area with the injection, you just want to make sure that the area is clean. There are no any kinds of lesions there. Just making sure that it's a good area to do the injection on. So what I'm going to do, after I inspected the area, I'm going to take my gauze and I'm going to cleanse the area, going inward to outward, allowing the area to dry. And then once the area is dry, I'm going to take my syringe with the needle on, uncap the needle, put it down, and then with the bevel up, I'm going to take the needle onto the skin, insert it about 1/8 of an inch in between a 5 to 15 degree angle, slowly inject the medication. And when you're giving this medicine, you want to observe a wheel. The wheel is going to be the indicator that the injection actually got into the site. Take out. And since you don't want to mess up the wheel, you would just gently take a cotton swab or gauze and just pat the area. And then once you are done with that, to remember where you've given the injection, because the wheel is going to disappear, you will just circle the area. Alright, perfect. Miss George has her TB done. Alright, so the next one that we are going to be doing, it looks like it will be an intramuscular injection, but this one we're going to give in the deltoid, which is about right here. Alright, so let's see what kind of injection. Alright, so again, I have my medications by my bedside. I'm accessing her medical record, and while I'm doing that, I'm going to have her verify her name and birthday again. Sally George, April 1st, 1995. And it looks like that the injection that we are going to be giving today for the IM and the deltoid is an influenza virus vaccine, 0.5 mL. We're going to give it IM once, and we're giving this prior to discharge. Alright, so that we verified that. Alright. So we will turn the patient so that she is in a good spot for us to give the injection. If she's wearing any clothes, you would simply pull that up. You would inspect the area for any type of lesions, redness, just making sure that the area is a good place to do the injection at. Any type of bony promises as well. So once you've inspected the area, where you're going to give it at, I can show it on myself. You're going to give it about right, so 2 inches, 2 fingers down from this part of your shoulder. Give it about right there normally. So once you've located the landmark, you go ahead and take your alcohol and cleanse the area, inwards to outwards again. Allow the area to dry. Take your needle, uncap it, and then using the Z-Track method, you would just use your non-dominant hand, spread the skin, hold the needle, and then you're going to inject it about an inch to an inch and a half in. Alright, so with the darting motion, you just boop. And you also give this injection at a 90-degree angle. Slowly injecting it at a rate of 1 milliliter per 10 seconds. And then after you've injected it, you would wait about 10 seconds before you withdraw the needle. After you've done that, just take a cotton swab or gauze, apply it to the area. Then you take a Band-Aid and just apply it on the patient. And there you have an intramuscular deltoid injection. Alright, so the next injection we're going to do is a second intramuscular injection, but this one is going to be in the vastus lateralis. So again, I have my medications near the bedside. I'm going to access my patient's MAR, or her medical record. Have her verify her name and birthday for me. Sally George, birthday April 1st, 1995. Looking at her medical record, she's going to be getting an influenza virus vaccine, 0.5 milliliters, IM. The frequency is once, and the time to be administered is prior to discharge. Alright, so now that we've looked at that, so when you're giving a vastus lateralis injection, the best thing maybe to have the patient lay down. Okay. So once the patient is in a good spot for you, you would go ahead and pull back the clothing if they're obviously wearing something. Inspect the area, making sure that it's a good place to do the injection. And then with the landmark, you would do it, your 2 hands right about there. And then you want to give it about right here. Right there. Alright, so once you've found the area, you're going to go ahead, cleanse the area with the gauze, inward to outward. Allowing the area to dry. You're going to go ahead and take your needle. You're going to uncap it. Same thing with the first IM injection we gave in the deltoid. You would go ahead and pull the skin back. You would go ahead at a 90-degree angle with the darting motion, inject the medication with a rate of 1 milliliter per 10 seconds. Wait about 10 seconds to withdraw the needle. Take a gauze or cotton swab, place it on there. And once you've done that, you go ahead and take the bandage. And there we go. Kind of looks like I gave it in her stomach, but I didn't. She just has a short leg. Alright, so the next thing that we are going to be doing is one final intramuscular injection, and this one is going to be the ventrogluteal area. And what makes this one special is we're also going to aspirate this one. Alright, so again, I have my medications near the bedside. We're accessing her medical record. While I'm accessing this, I'm going to ask her name and birthday again. Sally George, birthday April 1st, 1995. Looking at the record, she's going to receive a influenza virus, 0.5 milliliters, given IM with a frequency of once, And the time to be administered is prior to discharge, which is appropriate because this is what we're doing now. Alrighty. So you can have the patient actually laying sideways when you give this medication. I'm gonna put her like about that so you guys can see it. So now that she's laying sideways, you can actually go ahead and flex the hip to make it better for you to see it. We're going to go ahead and look at the area, make sure that it's free of any lesions, look for the bony prominences, any type of inflammation, and making sure that there's enough muscle tissue. You also want to do that with the medication with the injection that we did prior to this one, which was the vastus lateralis, making sure that there's enough muscle tissue in that area to actually give the injection. All right. So now that we've looked at that, we're going to place the heel of our hand on the greater truncular, thumb pointing towards the patient's abdomen. I'm going to give this medication about right here in this V area. I know it's kind of hard to see, but I'm going to give it about right there. Cleanse the site. Go inwards to outwards. Allowing the skin to dry, uncapping the needle. Then we're going to do the same thing that we did by pulling the skin. Encourage the patient to relax the muscles. Then with the darting motion, we're going to inject the needle at a 90-degree angle. And then this is where the aspiration parts comes in at. While we are getting needle injected, we're just going to stabilize the needle, and we would pull the plunger up. And what we're looking for is basically making sure that there is no blood coming in the medication. If you do see blood, that normally means that you're in a vein. If you don't see it, then you're good to keep going. So we're just going to go ahead and put the plunger back in there. And then go ahead and inject the medication at a rate of 1 milliliter per 10 seconds. Once you've done that, you wait 10 seconds to pull the needle out. Use your cotton swab at the area. And another thing, I know this is a pen, but normally when you pull the needle out, you have something on it that basically brings the needle back in or caps the needle to prevent any needle stick injuries. Alright, and then once you've removed the gauze, you can go ahead and put the Band-Aid on her. And she is good. Alright. And then the very last injection that we are going to be doing for our patient is called a subcutaneous injection. Now let's see. Start from the beginning. We have the medication near the bedside. We're accessing her medical record. And while I'm doing that, I'm going to verify her name and birthday one last time. Sally George. The birthday is April 1st, 1995. And it looks like the patient is on Humalog, which is a type of insulin. It looks like that she is on a sliding scale dosage. The route will be subcutaneous, and is given 3 times a day, with 3 times a day before meals and at bedtime. So let's see. Alright, so according to her record, with it being a sliding scale, her glucose level came back at a 210. So that means with the Humalog dosage that we would give, and she's on a sliding scale, she will be getting, the Humalog injection will be 4 units because her blood sugar is 210 like we said, and the sliding scale dosage, if you have 201 to 250 with her glucose level, you're going to give it 4 units. So 210 is right in between that. So Humalog 4 units. Alright, so I'm going to move her clothing if she has any to expose the site. We're inspecting it for lesions, for trauma, for inflammation, and any bony prominences. So what we're going to do is we're going to locate the area that we're going to go ahead and give the injection at. It's subcutaneous, so we do it in the stomach. So it's a good tissue to do it at. You guys can see it. All right. Now that we've located the area, we're going to go ahead and cleanse the area with the antimicrobial, going from the inward outward, allowing the skin to dry, uncapping the needle. And then what we're going to do, we're going to gently grasp the tissue, and then we're going to insert the needle quickly at the correct angle, which is about a 45-degree angle. Release the grasp, stabilize the syringe, and then inject the medication. Then we're going to withdraw the needle from the same angle that we inserted it. Use a cotton or gauze to wipe the site. Activate the safety device. And then apply the Band-Aid if it's needed. Alright, and this concludes our video of the 5 ways to do injections. Thanks.